Dakayta was actually brought to our attention before she was actually born. We knew that she had a fairly large myelomeningocele, or what most people would understand as spina bifida.
The spinal cord is open. If your spinal cord is open, that means your cerebral spinal fluid, it's all in communication with the outside world. So the biggest risk at that point is they can get an infection. If they get an infection, that's meningitis, and that's very serious in a baby. But what we aim to do is close the skin, create a barrier between the outside world and the spinal fluid, and therefore prevent an infection.
Reach in with this forceps and grab the white band.
Over time, it became obvious that Dakayta was not actually going to be able to get away without needing a VP shunt.
You follow the child's head circumference, and if the head grows inappropriately, which is a sign of fluid under pressure, then we make arrangements to place a ventriculoperitoneal shunt, which is the treatment for hydrocephalus. People who have hydrocephalus, they don't absorb the fluid, although they continue to make it.
Yeah, I'll take a couple more of those and then some Dermabond.
So you need to move it somewhere else. So the shunt is basically plumbing to move the fluid from the brain down to the abdomen, where it's ultimately reabsorbed into the bloodstream, just like it would be in the normal situation in the head.
I think it looks good.
I'll print one out.
And then once she finally got to the point where she had stabilized, was eating well, we were actually able to get her home at that point.
There's our miracle baby. We're enjoying her home right now.
I think the one thing that gives these kids the best opportunity for the best outcome is that there's a coordinated kind of care center that our neurosurgeons and other specialists manage for Spina Bifida Clinic, and that they are actually able to help these kids end up with their best outcome.